most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Today
Bob.
we're going to talk about the number one mistake we see people make with back pain, hip pain, knee pain, etc. This is a physical therapist viewpoint.
Boy, that's covering quite a bit of
Well,
anatomy
that's
with
how
one stroke.
we don't want to let anybody out. By the way, if you're new to our channel, please take a second to subscribe to us.
Oh.
We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com and go to the giveaway section because we're always giving something away. This week, it's a beauty. We're giving away the Sleepovation mattress. This is a little sample of one. It actually is a lot bigger. It comes in all the sizes, queen, king, California king. It's got individual mattresses. It's got air channels. Really comfortable. Really, especially if you have back pain or knee pain or hip pain or
I can attest to that, Bob.
Yep. And it also comes with a cover.
Yeah, this is just, you can look at,
and we're giving away a couple pillows, Sleepovation pillows.
We only got one here, though.
Yeah, they actually got springs in them. Very good support. Very comfortable, I think, for side liars.
You would never know there were springs in there. I don't really know how they do it, but it's kind of cool.
It's magic. All right. Also, if you go to TikTok, Instagram, or what else am I missing? Twitter, you'll find a 60-second version of our program. If you go to Facebook, you'll find the contest pinned at the top of the page.
That's right.
All right. So the first mistake we see people do is something hurts. What do?
Protect it.
They protect it. And
that's not necessarily a mistake.
It's not a mistake, but if they continue it, it is.
Right.
When they first heard it, a lot of times we want you to rest it. Mm-hmm. But very quickly, you want to... Actually, I just saw a study, Brad. That they don't...
Did you read it?
Yeah. They talk about the price method, protection.
Oh, sure, right.
And they thought, no, it should be the mice method, movement right away.
Oh, really?
They talked about like movement almost the first day.
Well, it's like after a knee replacement.
Right.
They get those moving
right
during surgery.
Look at the trauma that knee went under.
That's true. It's a good point.
So we're not judging, by the way. It's completely understandable. When you hurt an area, you don't want to move it. And it hurts to move.
Right.
So, and the swelling increases, the blood flow decreases, and tightness sets in. So we're going to just tell you ways to try to help get those areas moving that maybe are going to be a little less painful.
And that's a big core of physical therapy treatment is range of motion, get things moving. And there's some little tricks that you can make it move without pain, and that's our specialty.
Yeah, one thing is like we try to decrease the weight bearing on the area.
Right.
And we try to find the movement that works, and you start off slow.
Yep, exactly.
All right, let's talk about back pain. So I had a friend that worked in a back pain clinic. I've told this story probably 100,000 times, but he worked in the back pain clinic. All they saw was back patients. First thing they do, you get walking. They, because you see a lot of people with back pain, they're like, it hurts, so they lie down, they sit down, they're not moving. Now, you say, well, how do I decrease the weight on my back? Well, one, you avoid hills and stairs and stuff like that. But
flat surfaces.
Mm-hmm. But often they find out, actually, if you increase your speed, that decreases the amount of weight on your spine.
That's not saying you go speed walking,
no.
But from a slow, cautious pace to a smooth, little bit faster can make it feel better and let things work in.
And you really want to have good posture when you're walking.
Yeah,
so what we tell people a lot of times is to actually grab your wrist with the opposite hand and just pull back like this, that straighten jaw up. And sometimes we even have people walk like this, Brad.
Sure.
For a little bit, just to make sure they're all straightened out and they're not going like this.
Yeah.
So they go like this, and then they go for the walk, and they go at a higher speed.
Right. Now, if your back pain is so bad you cannot straighten up, and you can't, well, then you're going to have to go to one of our other videos.
Right.
There's some other exercises. But anyways.
Obviously, there are people that can't walk. I mean, but generally, I tell you, Brad, when I've had episodes of back pain, I'm running the next day. I'm back to running because it feels better with running when I get it moving. Now, the next one is we're going to want to do a directional movement. Do you mind just moving this, Brad?
Oh, sorry.
And the cane, too.
The cane, too?
So you're going to try to find a movement. The one that we find the go-to movement that for people with back pain, just to get things moving, is we bend the knees up like this. we call it the hook lying position. We just gently go back and forth like this. And you're just getting a little movement in the back, rotations. And if you find out one direction hurts, let's say it hurts going to the left, I'll just go to the right
There you
and
go.
work it that way for a while.
So his shoulders and upper trunk stay stationary, if you will, and so the pelvis and the knees kind of rotate together, and that puts a little movement in the back.
Now, another one you could try for if you're younger, I would say, like let's say you're less than 40 or maybe even 45, I would try press ups.
Sure.
So you're going to put your hands underneath your shoulders and you're going to lift up like this. You're not going to lift your pelvis up. Yep. And you're going to only go up to what is comfortable. So we do what we call micro press ups here to start off with. Starts to feel more comfortable. You can go further and further. Again, I'm keeping the pelvis down on the mat or the floor
Right.
or the bed, wherever you're at.
There are a couple groups of people. Usually they're older. But if you have spondylolisthesis, that could be any age, or stenosis.
Yeah, in that case, you're going to maybe want to try this movement then, like a single knee
Right,
to chest to
right.
start off with. Oh, excuse me.
Wow,
And then go
Bob.
to a double knee to
Yeah.
chest. So, correct,
Clear-
Brad?
Clear those pipes. Yeah, that's good.
All right. Next one is hip pain. So we want to get the hip moving. So again, the only one that we find out is actually the same one we do for back pain, Brad, is we have them lie down.
Sure.
And I have people do this before they even get out of bed.
Yep.
I say, you wake up in the morning and before you even get out of bed, put your legs into the hook line position. And now again, move the hips. Same thing holds true for them. If it hurts in one direction, don't go that direction.
Yep.
So, and
You could actually go into the clamshell, which would work more the hip joint itself.
you mean like this?
No, like that. Just
Like this?
Yeah,
Sure.
like butterflies kind
Yeah,
of a
you
thing.
can do butterflies.
Yep.
Just getting some movement. That's what we're trying to do. And you know what we find is that people, after they've been sleeping all night long and that joint hasn't been moving, it gets worse. That's the thing you want to understand about arthritis. It actually can get worse at rest.
Yes.
The joint likes to be moving. We want to get that synovial fluid moving. We want to get the blood flow moving. So anytime you can get some movement, it's gonna generally be better. It can get to the point. I've seen it in shoulders sometimes where arthritis got so bad, like it's way advanced stages that we don't do any movement. It just hurts you.
Yeah, the extreme cases.
But it's rare. I mean, that's usually someone's had it for a long time. Brad, you're going to show the fit glide?
Oh, absolutely.
So
Bob.
another way to get the hip, and we might as well jump ahead. This one is also good for the knee.
Right.
So-
It gets both, which it's not uncommon to have. If you got hip arthritis, you may have some tightness in the knees.
Now, if you're,
You want me to show it?
yeah, if you want to bring the chair over.
Oh,
now,
we're going to do it supine.
If you, oh yeah, we'll do a supine too,
Okay.
but we'll start with that.
Yep.
You can also go biking.
Oh,
You know,
you got it,
if
Liz?
you have or if you have like a stationary bike. We like the fit glide because one, we invented it, but two, it's really lightweight. Did we determine how much this weighs, Brad?
This is under 5 pounds.
You can lift it with one finger.
Yeah.
I mean,
Yeah, and the reason we invented it because there was nothing out there that fit the ticket, and we were always having a need for something like this in therapy, something that would work both legs, something that you could adjust the height so it's have a incline or flat on the floor, and something that will last forever and
I
work
think,
well.
Brad, the other point that you're not making is that a lot of times people, when they have a stiff knee or hip,
Yep.
they can't go the full circle. You
Sure.
know what I mean, they can go like halfway.
Yeah, that's
but
true.
they all can go back and forth.
Right, that's
mean,
a good point.
So it's a great one for starting. The only negative thing they're going to say, Brad, I know you don't like when I say this, but
Right.
it's not quiet. It does make a swishing sound.
Yeah, but not very much.
No, not very much.
Not very
and
much.
if you use
Silicone, just a drop or two. And I had a patient that used one in an office, a quiet office setting, and it made a little bit of that. Can you hear it? A little bit of that, and he just put a drop or two of silicone on each one, and it just quiets right out.
show it on lying down too, Brad, because you got your shoes on. This would work better with shoes, or sometimes we just take a towel. Or,
Yep.
Yeah.
I mean, it's a nice surface. It's not
Yeah.
going to cut you or anything.
So
And then you do this in bed. You know, if you're having a hard time getting out of bed, you need to exercise prior.
yeah, that's what I like about this thing. I can't think of anything else where you can work out like in bed like this and start moving that hip and knee before you even get up in the morning.
Yeah.
So
It's very light. And you can clean it very easily.
Yeah.
It's everything about it is beautiful.
again, you could try if you have like a stationary bike, you could try that if you already have
Oh,
one.
right.
And we're not saying you need to go buy one by any means. All right. After you've done that with the hip pain, we also wanted to, make sure you're walking with the hip pain, but you were going to probably want to walk with a cane.
Yes.
And generally, Brad, why don't you show? What you want to do is walk on with the cane on the opposite side.
Here's my sore leg, my left one. I'm going to put it in the right side. A lot of people will think that you should have it on the same side, but it's not true. And when you advance your sore leg, the cane advances with it. Typically, what I do with a patient, I'll say, put it in your right hand. It's a sore leg, and I won't give any instructions. And usually people, the sequencing
They
comes...
naturally go to it.
Yeah, exactly.
If you want to screw them up, you start giving them instructions.
Yeah, because then you start thinking about
start
it.
moving the cane forward, start moving the foot, and then they totally skip, and I just go walk, and then they go do it perfectly.
Falls into place.
So the knee pain is going to be the same thing. You could also walk with the cane, with the knee pain.
Knee or hip, yep.
Knee or hip.
Opposite,
so
yep.
The same thing. So get those joints moving. I mean, in most cases, it's going to be the right thing to do unless you have a fracture or something like that, some type of trauma.
Sure.
Obviously, then you need to see the doctor. But movement, right?
Yep, in a nice way.
All right. Remember, Brad and I can fix just about anything
except for
a broken heart.
That's right, Bob.
You can count on us.
Yeah, but this video is not going to help that one.
All right.